Hi, my name's Lois Robertson and I'm a fourth year medical student at the University of Dundee, and I'm currently on placement in general surgery here at Lorn Hospital. I don't directly work for them because I'm a medical student, but I've been on placement here. This is my fourth week and my final week on placement in Oban. The Oban placements, they offer two placements to medical students in Dundee. So there's a general medicine placement and a general surgery placement here for a month. And they've got a very good reputation within the medical student body at Dundee University. We hear the teaching's very good, as well as the location. It's a great place to see a wee bit of Scotland, and on the other side of Scotland from Dundee. So for that reason, that's why I wanted to come here. From what I've seen, they have very strong team working skills, and I mean that interdepartmentally. So they have a daily meeting in the morning, and there's a lot of conversation between the different departments that I've been really impressed with, and they're very willing to help each other out across all areas of the hospital. And there's a real sense of camaraderie, I suppose, and working with each other, which I really like about this hospital. It's not something that you see in the bigger hospitals, really. So I really like that about being on placement here. In terms of positive things, I've seen a lot of things that I really like about this hospital. There's a definite sense of continuity of care with patients because it is quite a small community, just in comparison with other placements I've been on, and for that reason the patients really get to know the doctors that work in the hospital, and the doctors all know each other really well, and all the staff know each other. So I mean, I'll walk in, I've only been here for 4 weeks, and I will say hello to the receptionist, I will say hello to the porter, and I will know everybody, and that's something that I just haven't had an experience of in other hospitals. And I think that's a really strong positive for this hospital. And they go the extra mile for patients as well. So there's been a few occasions when a patient maybe has got a bit muddled up and has come in for an outpatient appointment on the wrong day, and instead of just turning the patient away, they'll make that extra effort to see the patient on the day. And again, it's not something I've seen anywhere else, and I think it's a really nice thing about Oban. I've been here a month, and I have been able to go running in the month, and I go swimming at the leisure centre, which is great because it's not that far away from the hospital. It's located quite centrally. I've also been able to go and visit some of the islands in better weather, and there's a lot of hiking opportunities and walking, which has been really good. And that's about all I've been able to do, but I have only been here for a month. But there's a lot of outdoors. If you're quite outdoorsy, I think it's a really good place to come. And I've had a lot of recommendations from all the staff here about good walks to go on, hikes to go on, and cycling routes and things. So I'd love to come back in the summer and really kind of explore. I don't know if I'd really describe it as a challenge, but it is the most rural setting that I've been on placement on. So there's definite differences in the way that things are run here in comparison. I'm normally based in Islands Hospital, which is obviously a lot bigger. So just referral pathways are slightly different, and knowing when you have to stop care for patients in this setting and maybe transfer them to Glasgow is something that I've had to learn. Again, as a medical student, that's been a bit of an eye-opener for me, and seeing how patients are referred in a rural setting. So maybe from the islands they can come in and sometimes have quite delayed presentations because they've not presented early. So that's a bit of a difference as well. I think it'd be a great place to work. From what I've seen, it's a very friendly place. Everybody knows each other here. The staff all get on really well from what I've seen. Everybody has their own kind of wee specialist area, so you know the strengths and weaknesses of the team, and you know them really quite well. And yeah, I think it'd be a nice place to work. I'd like to work here. I'd just like to say that I think from a training perspective, the quality of the teaching that I've received on this block in comparison with other places has been really quite high. I think that's down to the staff and the people that work in this hospital, because they're so welcoming to medical students, and I think that needs kind of recognised, because it's been really good.